Let us quickly revise the rotator cuff muscles. What are the rotator cuff muscles? Supraspinatus, infraspinatus, teres minor, and the subscapularis. Subscapularis. If you have a look at where the muscle originates, what is the course of the muscle, and where it inserts, you can easily predict the action of the muscle. For example, the supraspinatus originates above the spine of the scapula, courses under the acromion, and inserts on the greater tuberosity. So you can easily predict that when this muscle contracts, the shoulder is going into abduction. If you look at the infraspinatus and the teres minor, they are originating below the spine of the scapula and coursing and inserting on the posterior aspect of the greater tuberosity. Now you can predict by contracting this muscle, the shoulder would go into external rotation. Okay, then if you look at the subscapularis, this muscle originates from the anterior aspect of the scapula, courses and inserts on the lesser tuberosity. So when this muscle contracts, the shoulder would go into internal rotation. Okay, so this is roughly the course of the muscle and the action of the muscle. If you look at tears of the rotator cuff, in young people it is mainly due to trauma. In elderly it is mainly due to degeneration. Okay, so to know the tests of the muscle, you need to know the action of the muscle. You just need to resist the muscle action. For example, to test the subscapularis muscle, so as we discussed, this is an internal rotator of the shoulder. Now these tests, for example, the first one is called as lift off test. What is done here? The patient is asked to keep the palm over his back and lift the palm off his back. To perform this, the subscapularis needs to be intact. This is nothing but internal rotation of the shoulder. Another way of doing the internal rotation is pressing the palm over the belly. This is called as belly press test. And the last way of examining it is the bear hug test. So three ways of examining the subscapularis. Next, the most important muscle, the supraspinatus. One most important test for this is the empty can test or the Job's test. Okay, here the shoulder is made to rotate internally. The examiner stabilizes the scapula and the shoulder is abducted in the scapular plane, that is 30 degrees anterior to the frontal plane, and against resistance the arm is asked to abduct. Okay, so here if the patient is having a tear in the supraspinatus muscle, it manifests as pain over the affected area. Okay, so other test for this other than Job's and empty can is the full can test. Okay, this empty can is done in internally rotated shoulder, that is your thumb is pointing down as if you are emptying something, as if you are emptying the can. Okay, a full can test is the reverse, that is it is done in external rotation, the thumb would point up. Okay, so that is empty can and full can test. For the teres minor and infraspinatus, as we discussed, they are external rotators of the shoulder. Now we need tests or we need movements which would check this external rotation, and one such is the horn blower test. Okay, bent elbow, abducted shoulder. Okay, so horn blower test, which would need a significant amount of external rotation of the shoulder. So these are the tests for rotator cuff tears. So MCQs like forgotten tendon of the rotator cuff, the answer is subscapularis. The most common tendon to rupture is the supraspinatus. And on injecting anesthetic agent into the subacromial space, for example, there is a tear and the patient is not able to perform the movements because of the pain, and you have injected a local anesthetic. The pain decreases, but the patient will still not be able to perform the movements because there is an actual tear, there is actual discontinuity of the movements. Okay, so how do you treat this? Initially you try conservative methods like NSAIDs, physiotherapy and ROM exercises, and you keep monitoring the patient. If the patient is not getting better, you perform adequate scans and plan for repair. A repair of the tear. This may be arthroscopic or open repair, but arthroscopic is preferred. And in case the tear is not amenable to repair, then in young patients you go for tendon transfers. And in old patients you go for arthroplasty, the joint replacement. And specifically for rotator cuff tears, you do something called as a reverse shoulder arthroplasty. A reverse shoulder arthroplasty.